Welcome to the deep dive. Looks like you've sent us quite a collection of research on primary hyperparathyroidism. We've got journal articles, patient materials, even some visuals in here. So you're really going deep on this one, huh? Get ready because we're about to uncover some seriously surprising stuff about this condition.
It really is an intriguing area,
Yeah,
and one that deserves a lot more attention, I think.
I totally agree. So let's kick things off with the basics. Um, we've got these tiny little glands in our necks. The parathyroid glands, right? They're the ones calling the shots when it comes to calcium in our bodies. But in primary hyperparathyroidism, things get a little, well, out of whack.
Exactly. One or more of these glands starts making way too much parathyroid hormone, PTH. And that hormone, it's basically the boss when it comes to calcium. So it's like a thermostat gone haywire. It's just constantly telling your body to pump more calcium from your bones right into your bloodstream.
Okay, so it's not as simple as just having too much calcium. It's more about this whole hormonal miscommunication going on.
Exactly. And that's what makes it so tricky. This elevated PTH, it keeps pushing those calcium levels up. But the symptoms can be so subtle. Sometimes there aren't even any at all.
You know, that's what really struck me when I was going through all this research. The most common presentation is actually asymptomatic hypercalcemia. High calcium, but no symptoms to tip you off. It's like a silent thief in your body.
That's a perfect way to put it. It really highlights why routine blood work is so important. It's often how this condition is even discovered, just sort of by chance when someone's getting tested for something completely different.
Makes you wonder how many people are walking around with this and have no clue. So if someone does have symptoms, what might they experience? I'm seeing a lot of kind of vague stuff here, like fatigue, weakness, maybe some digestive issues.
Yeah, it can be a real mixed bag. It really can. And that makes diagnosis a challenge. You might have fatigue, you might have muscle weakness, bone pain, or even kidney stones. But these are all pretty common symptoms, so it's easy to think it's something else entirely.
No wonder it gets missed so often. So how do doctors even start to figure out if it's actually primary hyperparathyroidism causing these symptoms or if it's something else entirely? I mean, where do they even begin?
It's a lot like detective work, really.
Yeah.
They start by taking a very thorough medical history. They do a physical exam, of course, and they'll listen very carefully to how the patient describes their symptoms. Then it's on to blood tests. Those are crucial.
Okay, so checking those calcium levels, obviously that's key. But I'm seeing some other things mentioned here too, like PTH levels, vitamin D, even something called markers of bone turnover. What are those all about?
You're right. It's not just about calcium. Measuring those PTH levels, that helps to confirm if the parathyroid glands are actually the ones acting up. And vitamin D is important too because it affects how your body absorbs and uses calcium. And those markers of bone turnover, those are like little clues. They tell us how much calcium is being pulled from the bones into the bloodstream.
So it's like putting together a puzzle. You're looking at all these different pieces to get the full picture.
Exactly. And this is where things can get even trickier because there are other conditions that can mimic primary hyperparathyroidism. So it really throws a wrench into the whole diagnostic process.
Oh yeah, I was just getting to that. My notes here mention malignancy, which is cancer, right? And then there's this, oh boy, familial hypercalcemia, or FHH. Try saying that 3 times fast.
Right. Malignancy can sometimes cause those calcium levels to go up too. It can look a lot like overactive parathyroid glands and FHH, as you mentioned. Yeah, that one can be a real head scratcher. It's a genetic condition, also causes high calcium. But the key difference is that it's benign. It doesn't need treatment.
So 2 conditions, both with high calcium, but one needs attention and the other one doesn't. How do doctors tell them apart? That seems pretty important.
That's where those PTH levels we talked about, those are really key. If you've got high PTH along with high calcium, usually points to primary hyperparathyroidism. But if that PTH is low, then malignancy might be a bigger worry. And for FHH, it's all about the urine. People with FHH tend to have low calcium in their urine, and that helps to differentiate it from primary hyperparathyroidism.
Wow. So it's not just one simple blood test. There's a lot of nuance here, a lot of other factors to think about. And I see something here too about medications. They can make things even more complicated, right?
Absolutely. Certain meds like thiazide diuretics, those are often used for high blood pressure, and lithium for bipolar disorder, those can actually affect calcium and PTH levels so they can mimic hyperparathyroidism or they can even mask it. It can go both ways.
So this is even more complex than it seems at first glance. And I'm guessing this is where having a really skilled medical team makes all the difference. You need someone who can look at all these results, make the right connections, and figure out what's really going on.
You've hit the nail on the head. It's all about looking at the whole picture. The symptoms, the blood work, the patient's medical history, what meds they're taking, it all comes together to get that accurate diagnosis.
Okay, we've covered a lot of ground already. We've talked about how sneaky primary hyperparathyroidism can be, how it can fly under the radar, and the importance of those blood tests and catching it. But this is where things get even more interesting. You ready to dive deeper?
Oh, absolutely. I'm always ready for a challenge, especially when it comes to figuring out the mysteries of the human body. It's amazing, isn't it? These tiny little glands, they can have such a big impact on our health. It really shows you how connected everything is in the body.
That's what's so fascinating about this whole thing. We usually think of calcium, strong bones, teeth, right. But it's so much more than that. It's like it's involved in everything. Muscles, nerves, even how we feel mentally.
It really is. Calcium does so much. And when those parathyroid glands are stuck in overdrive, pumping out all that extra PTH, it can really throw things off balance.
So let's talk about what actually happens when those PTH levels are high all the time. I'm seeing some pretty concerning things in these research papers. Bone weakening, kidney problems, even some potential links to mental health issues like depression and anxiety.
You're right. There can be some serious consequences. Let's start with bone health. So we talked about PTH. Its main job is to keep that calcium balance in the blood, right? If it senses calcium levels dipping, it kicks off this process. It's called bone resorption.
Bone resorption, that sounds kind of intense.
It is, in a way. Basically, it's the breakdown of bone tissue to release calcium into the bloodstream. It's a normal process. It helps to keep things in balance. But when PTH is always elevated, it's like your body's constantly in overdrive, pulling calcium from your bones all the time.
So it's like the bones are being mined for calcium just to keep those blood levels up.
Exactly. And over time, this can lead to osteoporosis. That's when the bones become weak and brittle. And that makes you much more likely to get fractures.
Yeah, definitely not something you want to mess with. And what of the kidneys? How does all that extra calcium affect them?
Well, the kidneys are like filters.
Right.
They get rid of waste products from the blood, and that includes calcium. When those calcium levels are high all the time, it puts a lot of stress on the kidneys, and that can lead to kidney stones.
Ouch, kidney stones. I've heard those are incredibly painful. And I'm seeing some stuff here about other kidney problems too, even a decline in kidney function over time.
You're right. In some cases, that chronic hypercalcemia, it can actually damage the kidneys, especially if it's not treated.
So that's bone weakening, kidney problems, and then there's this whole connection to mental health. I have to admit, I wasn't really aware of this before I started digging into all this research.
Yeah, it's been getting a lot more attention lately. And there's growing evidence that there's a link between primary hyperparathyroidism and mental health. Some studies show that people with primary hyperparathyroidism are more likely to experience depression, anxiety, even cognitive problems.
Yeah.
Trouble thinking clearly.
That's really interesting. What's the thinking behind that connection? Is it the calcium messing with brain function directly?
We don't know for sure yet. The research is still ongoing, but it seems like those hormonal disruptions, the ones caused by primary hyperparathyroidism, they probably play a big role. Calcium is super important for how nerve cells communicate in the brain, so it makes sense that if things are out of whack there, it could have some pretty noticeable effects.
Another example of how everything's connected in the body. One seemingly small problem can have ripple effects everywhere.
Exactly. It really highlights why we need to look at health from a holistic perspective.
Okay, well, this has been incredibly eye-opening. We've gone from these tiny little glands to these pretty major effects on the bones, the kidneys, even mental well-being. I bet our listeners dying to know what can be done about this. So let's shift gears a bit. Talk about treatment options.
Perfect timing. There's definitely hope. And the good news is we've got some effective treatments for primary hyperparathyroidism. The approach, though, it really depends. It depends on how severe the condition is, the patient's overall health, and what they prefer.
Okay, so let's break that down a bit. I'm seeing surgery mentioned a lot here. Is that usually the first line of treatment?
For a lot of people with primary hyperparathyroidism, surgery is often the way to go, especially if they're having symptoms or if there are complications.
And what happens during surgery? They remove the gland that's causing the trouble, right? Like taking out the broken thermostat.
That's the basic idea. The goal is to get that PTH production back to normal, get the calcium balanced again. And they do that by removing the gland or glands that are overactive. And the good news is surgery has come a long way. It's much less invasive than it used to be, and it's generally very safe.
Well, that's good to hear. But I'm guessing there are times when surgery isn't the best option, or maybe there are other things that can be done?
Absolutely. For people with mild or asymptomatic primary hyperparathyroidism, sometimes watchful waiting is the best approach. They monitor the calcium and other markers regularly. The idea is to keep an eye on things, and if things start to get worse, then they intervene.
So it's all about weighing the risks and benefits for each person. And I'm seeing some stuff here about medications too. Some meds that can help manage primary hyperparathyroidism. What can you tell us about those?
There are some meds that can definitely help, especially for folks who aren't good candidates for surgery or who would rather not go that route. One type of medication is called calcimetics. Cinacalcet is the most common one. These meds, they basically trick the parathyroid glands, make them think the calcium levels are higher than they actually are, and that reduces PTH production.
So it's like a way to turn down the thermostat without actually removing it.
A perfect analogy.
Yeah.
And then there are bisphosphonates. They can be really helpful, especially for protecting the bones. Bisphosphonates slow down that bone resorption process, so they help preserve bone density and lower the risk of fractures.
Good to know. So there's a whole range of options: surgery, medications, watchful waiting. And it sounds like the best choice really depends on the individual and their situation.
Exactly. It's about finding what works best for each person. And it's important to remember, treatment for primary hyperparathyroidism, it's not one size fits all.
We've covered so much ground already, from those subtle symptoms to the diagnostic challenges to all the different treatment options. And I know we're both eager to talk about what's next, what's on the horizon for managing this condition. But before we get into that, let's just pause for a second, give our listener a chance to catch their breath.
Good idea. It's a lot to take in. We don't want to overwhelm anyone.
Welcome back. It's the final part of our deep dive into primary hyperparathyroidism. We've talked about how tricky this condition can be, how it's diagnosed, how it's treated, but now I want to look ahead. What's next? What's on the horizon for dealing with this thing?
It's a pretty exciting time to be talking about primary hyperparathyroidism. Research is moving so fast. There are some really amazing things in the works. It feels like we're about to enter a whole new era in how we manage this condition.
Okay, I'm all ears. Tell me more.
One area that's super promising: less invasive treatments.
Hmm.
Imagine, being able to basically reprogram those parathyroid glands that are causing trouble, turning off that excess PTH production. And you wouldn't even need surgery.
Wow, that sounds almost too good to be true. How would that even work?
Researchers are looking at a bunch of different approaches. Gene therapy, for instance. That could potentially deliver a corrected gene to the parathyroid glands, get them functioning normally again. And there are other targeted therapies too. Those might focus on blocking the specific pathways that cause PTH to go into overdrive.
So it's like a more precise approach. You're going right to the source of the problem without messing with other things in the body.
Exactly. And the potential benefits are huge. Think about it. Less invasive treatments,
Yeah.
shorter recovery times, fewer risks.
That would be a game changer for so many people. I'm also seeing some interesting stuff here about early detection, some real progress being made there too.
Early detection, that's absolutely key, especially with primary hyperparathyroidism because it can be
Oh.
silent for so long. They're developing blood tests that are even more sensitive and specific. They can pick up on those tiny changes in calcium and PTH, potentially even before you have any symptoms.
So it's like having an even better radar, catching those signals early on.
That's it. And some researchers are even using AI, artificial intelligence, to analyze blood work, looking
Yeah.
for patterns, those subtle clues that might point to primary hyperparathyroidism. What if AI could tell us who needs more testing, who needs early intervention? The possibilities are amazing.
Wow, that's incredible. It feels like we're really close to some major breakthroughs in how we manage this condition, from detecting it earlier to treating it more effectively.
I think so too. And it just goes to show staying informed is so important. Understanding your health, advocating for yourself, knowing about these advancements, that's how you get the best possible care.
Couldn't have said it better myself. Well, we've covered a lot of ground today, from those tiny little parathyroid glands to all the ways calcium imbalance can affect us, and the research that's paving the way for better treatments in the future.
It's been great sharing this journey with you. Hopefully you're leaving with a much better understanding of primary hyperparathyroidism.
And as we wrap things up, one last thought to leave you with. What if those treatments of the future, what if they could not only fix the hormonal problems, what if they could reverse the damage that's already been done to the bones, to other organs? It's something to think about, isn't it, as you continue to explore this fascinating topic?
Keep diving deep. Keep those questions coming. The pursuit of knowledge, that's an adventure worth taking.